CPR Cardiopulmonary Resuscitation. Heart and lungs are the two vital organs of the human body that function throughout the life. Any lapse in the function of these two organs for a short period of time can throw life out of gear. India witnesses at least 3 million deaths annually resulting from cardiovascular diseases, among which heart attacks form a major chunk. 1 in 4 deaths in India are now because of cardiovascular diseases, with the ischemic heart disease and stroke responsible for greater than 80% of this burden. These diseases tend to affect the patient in most of the productive years of their life and result in catastrophic social and economic consequences. Unfortunately, heart attacks knock at our doors when we are least prepared. Statistics testify the fact that at least 7 out of 10 cardiac arrests happen at home. As a matter of fact, it may happen at any place and at any time. Did you know? Many cases of heart attacks, if managed well initially, can reduce the mortality. First few minutes following a heart attack are crucial, and a good attempt to revive the cardiac function through CPR improves the chances of survival. How well are you equipped? We rarely think about ourselves facing an awkward situation like being next to a person who suddenly sustains a cardiac arrest, or electrocuted, or just rescued from drowning, or at a site of road traffic accident. What will be your move? Will you be able to help those in need? What if they are your near and dear ones? Will you stand helpless watching the whole sequence of tragedy unfolding in front of you? What should you know to become a savior from a mum audience? CPR, Cardiopulmonary Resuscitation. In simple words, it is a manual technique of stimulating and reviving cardiac and lung function. This is a basic technique which can be performed manually in order to revive the person drifting towards death. All it takes a basic training and the willingness to save lives. This life-saving technique is useful in many emergencies such as heart attack or near drowning, in which someone's breathing or heart rate has stopped. What should you know primarily? Most of the death results from irreversible stoppage of heart and lung function. Heart is responsible for maintenance of circulation and therefore ensures continuous supply of nutrients and oxygen. Lungs is the site for gaseous exchange where oxygen is absorbed and carbon dioxide is given out. Therefore, in many instances of emergencies, if the heart and the lung functions are restored and sustained as long as a trained medical personnel are available, it goes a long way in saving many lives. Which are the conditions where CPR is useful? It is performed when an individual shows no signs of life or unconsciousness or unresponsiveness, not breathing or gasping. Some of the conditions are cardiac arrest, trauma, poisoning, severe asthmatic attacks, respiratory illness, attempt to hanging, cardiac disease in children, road traffic accident, electrocution, shock. Steps involved in CPR. Dangers. Access for danger around the place. Make sure it is safe and there is no threat involved in approaching the affected and performing the procedure. Example, gas leaks, live electric wires, loose sand, etc. In cases hazardous area, consider your own safety too. Response. Check for the consciousness of the patient. If unconscious or having altered consciousness, try awakening the patient. If you can, check the pulse if palpable. Send for help or shout for help. If the place is isolated, make a phone call if unheard by anyone. If you happen to get help immediately, then put them to task as per the protocol. You will be better off managing the condition when two of you are instead being single-handed. Loosen the clothes of the victim. If wearing tight cloth, make sure the patient lies in supine position and is on a firm, flat surface. Airway. Clear the airway initially by checking if anything is stuck in the mouth or throat, and later by tilting the head backwards and lifting the chin upwards. Normal breathing through look, listen and feel method. Look for chest movements of respiration, listen to the breathing sound, feel for breathe. Using the heel of your hand supported by the other hand, apply the chest compressions. Interlock your digits such that you apply the weight of your upper body while you perform the compressions. Keep your elbows straight so that you apply the pressure appropriately on the center of the chest. 30 compressions. It should be at least 5 cm deep, performed on the center of the chest at a rate of at least 100 per minute, and the count should be as 1, 2, 3, 4 and 5. Check for the pulse. If possible, give 2 artificial breath and after a set of 30 compressions. When you instill the breath, lock your mouth and plug the nose. Avoid in case of poisoning. Repeat the process as long as the medical aid arrives. Remember, chest compressions are effective even in the absence of artificial breath.